Hello, everyone. Pregnancy and childbirth is an age old issue. But recently, there's a lot of emphasis which is going on regarding safe childbirth and a normal, healthy child. And to ensure a normal, healthy child, we have developed a special branch of obstetrics which is called fetal medicine. In that, what we do is because the parents would like to know whether the baby is structurally and functionally fine, we make sure that the pregnancy undergoes through a series of tests so that we understand whether all the organs of the baby are fine. But not only the organs, it's also very important the baby after birth functions normally as far as hearing is concerned, seeing is concerned, intelligence is concerned. And it's really sad when a baby, after a lot of delivery problems and all, comes up that cannot speak. There is a neuromuscular behavioral problem, developmental delay, spastic child, cerebral palsy, etc. etc. And therefore, to make sure, we need to know the genetic status of the baby. And the commonest genetic abnormality is called Down syndrome. Now, in order to understand Down syndrome, we have to know that all the cells in our body have chromosomes, which are 46 in number. And whenever there is an extra chromosome, number 21, then the baby suffers from Down syndrome, which is mental retardation. And in order to catch hold of these Down syndrome babies, we have developed screening tests called double marker, first trimester screening, triple test, quadruple test, etc. What they do is find out whether the mother has a high risk or a low risk of having a Down syndrome baby. Now, if suppose there is a report which comes as high risk, then the patients are referred for amniocentesis. Now, after amniocentesis, the amniotic fluid, which is the fluid around the baby, is taken and sent to the lab. The age-old test is called karyotyping, where all the chromosomes are numbered. But recently, a new test has come up about a decade or so, which is called chromosomal microarray, where the same chromosomes 46 are seen at a much greater details, which is called greater high resolution. And we can find out whether there are micro level deletions or duplications, some extra material there, or absence of material, which can cause to different types of problems, not only Down syndrome. So basically, what started as Down syndrome has now expanded into other chromosomes. So with this chromosomal microarray, we can not only know chromosome 21, but we can also find out about all the rest of the total 46 chromosomes. Now, this chromosomal microarray is also very important to understand when, for example, on ultrasonography, we see that the baby has some minor issues, like there is a small hole in the heart, a little cleft in the lip, and things like that. In those cases, also there can be some association with genetic abnormality. And therefore, we do this amniocentesis or CVS, take out the fluid or the placental tissue and send it for chromosomal microarray. And as per the guidelines, both in UK and US and also in our country, the first test to be done is chromosomal microarray. And there are two types of chromosomal microarray, the low resolution and the high resolution. High resolution is slightly costly, but it is better to get it done. If not so, then we settle for the low resolution microarray. And the microarray is normal, then more or less we are assured that the baby is fine and we can carry on with it. So I think this introduction of chromosomal microarray, or is it called CMA, is one of the greatest advances in fetal medicine, whereby we can assure that the mother and the couple and the family can have a healthy baby, which is the real onus of why women become pregnant at all. Because we have to look after Gen Next. The Gen Next generation is the most important thing that we doctors should be careful about. Not only the doctors, the family, and the society and the government as a whole are really needed to gear up cases to find out these abnormalities and to find out any treatment if there